Good morning, and welcome to another exciting edition of Mystery Diagnosis, News You Can Use. I'm your host, Brock Phillips. Today, we take you to the case of little Molly Parker, an ordinary girl, or was she? Molly Parker was turning pale and shaky during ballet practice. Her heart and lungs were simply giving out. On severe cases, she even...
So Molly Parker, we've been told you've been struggling with this mysterious disease for 5 years of your life now. How old are you now?
16.
So that means they started when you were 11?
Yup.
So what did your episodes feel like?
It sucked.
Sucked how?
It was messed up. My chest, I couldn't breathe at all. Felt my lungs were on fire. Just felt like I was gonna die, basically. It happened all the time. Like, it was just messed up. I was just trying to do like my ballerina dance, like just practice it, you know, because I wanted to be as good as the other girls. And I couldn't even do that. I did one PA and I fell over, you know what I'm saying? And I went to the doctor. And they just said it was asthma, and every time I exercised I got asthma because I was a little obese, but I knew it was wrong. I can't, you know, I can't tell a doctor they're wrong, so.
So we're here at the hospital with Dr. Waynick. She was Molly's pediatrician and was first able to notice that something was seriously wrong with Molly. What were your first impressions of Molly?
Well, at first, she was just a normal girl. I couldn't find anything wrong, but after a closer observation, I noticed a strong heart murmur.
Can you tell us what a heart murmur is?
Yeah, a heart murmur is an abnormal sound caused by irregular blood flow through the heart. And if the other doctors were right, then there would be no heart murmur, so this indicated there was something wrong. The murmur was occurring during systole, which is when the ventricles pump blood into circulation. So while listening to her heart, I heard a whistling sound. This indicated that there was some obstruction or resistance to blood flow.
So what additional measures did you take?
Well, I was immediately concerned for little Molly's health, and I contacted my friend, who's a pediatric cardiologist, and referred Molly to her. I'm sure she would talk to you if you wanted more information.
Well, thanks for talking with us.
This is my pleasure.
So we're here at the hospital with Dr. Wellington. She was the first pediatric cardiologist that correctly diagnosed little Molly. How were you able to do this?
Well, the primary means of diagnosis for pulmonary hypertension, which is what little Molly has, sadly, is a heart catheterization. And what that really means is we take a thin flexible tube and thread it through a vein into her right ventricle and the pulmonary artery, and that lets us determine the pressure. We found a higher than normal pressure in little Molly's artery, which indicates a pulmonary hypertension. Well, as I said, secondary pulmonary hypertension can be caused by a variety of factors, but idiopathic pulmonary hypertension is a little different. We think it may be genetic, but it's still a bit mysterious. For some reason there is an overgrowth of cells or a buildup of scar tissue or just some restriction in her pulmonary vasculature. Oh, there are a number of complications and very, very severe consequences. The patient can cough up blood can be forced to the lungs. It can cause arrhythmias, right heart failure. The right side of the heart actually gives out from pushing too hard against this resistance, and serious blood clots that can cause death of tissue. The most prominent treatment are vasodilators, which is what we put Molly on. You can also use calcium channel blockers, which just regulate the heartbeat. In Molly's case, we actually had to surgically implant a pump that gives her a continuous intravenous dose of prostacyclin, which again is a vasodilator, and what that will do, it will lessen the resistance in her vasculature and let the blood flow more freely.
Well, good to hear from you. Thanks for taking time out of your day for talking with us.
Oh, it was no problem.
And this has been another rendition of Mystery Diagnosis, here on News You Can Use. I'm your host, Brock Phillips, and I think we speak for everyone by saying good luck, little Molly Parker. We leave you with a few clips from her practice ballet. Good night, or good morning.